Which action should the nurse take first for a client with a suspected stroke? A. Check blood glucose. B. Administer aspirin. C. Start IV fluids. D. Lower blood pressure. Checkmark. Correct answer. A. 2. The nurse is teaching about insulin administration. Which insulin has the fastest onset? A. Regular BNPHC glargine. D. Lispro. Checkmark. Correct answer. D. 3. Which finding indicates a client is experiencing anaphylaxis? A. Bradycardia. B. Hypertension. C. Wheezing and stridor. D. Increased urine output. Checkmark. Correct answer. C. 4. A nurse is caring for a client receiving opioid analgesics. Which assessment is the priority? A. Pain level. B. Respiratory rate. C. Blood pressure. D. Bowel sounds. Checkmark. Correct answer. B. A patient receiving IV potassium chloride, KCl, develops peaked T waves on the ECG. What is the priority nursing action? A. Slow the IV infusion and continue monitoring. B. Stop the infusion immediately and notify the physician. C. Administer calcium gluconate as prescribed. D. Obtain a serum potassium level. Correct answer. B. Stop the infusion immediately and notify the physician. Which medication should the nurse question before administering to a client with asthma? A. Albuterol. B. Montelukast. C. Propranolol. D. Fluticasone. Correct answer. C. A nurse is caring for a client with increased intracranial pressure, ICP. Which action is appropriate? A. Place the client flat. B. Suction frequently. C. Elevate head of bed 30 degrees. D. Encourage coughing. Correct answer. C. 8. A nurse is caring for a client with heart failure. Which assessment finding should be reported to the provider immediately? A. Weight gain of 1 pound in 24 hours. B. Crackles in both lung bases. C. Blood pressure of 138/86 of a millimeter of mercury. D. Heart rate of 88 bpm. Correct answer. B. 9. Which intervention is priority for a client experiencing hypoglycemia? A. Administer insulin. B. Encourage ambulation. C. Give 15 grams of fast-acting carbohydrates. D. Restrict oral intake. Correct answer. C. 10. Which finding is expected in a client with hyperkalemia? A. U waves on ECG. B. Muscle weakness. C. Polyuria. D. Hypotension. Correct answer. B. Muscle weakness.